Hello everyone, welcome to my medical English teaching channel. In today's lesson, we will learn some common terminologies about the medications. If you live in an English-speaking country, it is very important that you understand where and how to get medications when you feel unwell. And you also need to understand what things you should be aware of before taking medications. So let's have a look. If you think you have a simple problem like a cold or flu, you can directly go to a pharmacy to buy the medications. So the shop that sells the medication is called a pharmacy or chemist. So you can go to a pharmacy to buy the medications. Now, if you are not sure what kind of medications you should take, then make sure that you get some advice from the pharmacist who work in the pharmacy. So pharmacists are those professional people who work in a pharmacy to provide expert advice about medications to the customers. Okay? So make sure that you go to a pharmacy and then consult pharmacists to get some advice about medications. Then you can understand what medication you should take, how often you should take, and what things you need to be aware of. All right. So this is to ensure that you get safe medications. Okay. Now, but not all the medications can be freely accessed from pharmacy. So some medications cannot be freely accessed from pharmacy without a prescription from doctor. So if you think your health problem is a bit serious and you need some important medications, then you need to go to see a doctor in a clinic to get your health checked. And then after the doctor checks your health, the doctor will decide what medications you should take. And then the doctor will prescribe some medications and give you the prescription of the medication. Okay? Then you need to take this prescription to the pharmacy and hand the prescription to the pharmacist to get the medications. Okay? So some important medications cannot be freely accessed from pharmacy without doctor's prescription. So the pharmacist needs to see a prescription from the doctor before they can give you that medications. All right. And these are some important words. Now, after you get the medications, you need to check something. Now, every medication has two names written on the container, right? One is a generic name and one is a brand name. Now, so every medication package has two names, generic name and brand name. Now, brand name is a name given by the company who make and sell this medication. But generic name is a name for the ingredients of these medications. Okay, so these are very different. So brand name is a big name written on the package, and generic name is a small name located underneath the brand name. Right. For example, everyone knows the medication called Panadol. So Panadol is a brand name, but paracetamol is a generic name. Yeah, Panadol is a brand name, but paracetamol is a generic name, right? Because paracetamol is the ingredient of this medication, but Panadol is a name given by the company who make and sell this medication. And there are different companies that make and sell the medications. Okay, so one medication could have different brand names, but only one generic name. Okay, because different companies could make one medication with the same ingredients, but with different brands. Okay, so that's something you need to know. Also, before you take the medication, you need to check something. You need to check the name of the medications. So make sure that you take the right medication. And you also need to check the route of the medication. So route means that how do you take this medication? Now, different medications are given in different routes. So, for example, some medications are given through the mouth, and this is called oral medications. Some medications are given as a cream, and you apply the cream on the skin, so skin can absorb the medications. So these medications are called the topical medications. The topical is to apply on the skin for the skin to absorb. So oral means you take the medication through the mouth and you swallow the medication. All right. So different medications can be given through different routes. Okay. So check the route of the medications. For example, if you have if your eyes has an infection and you need some eye drops, right? So so you get eye drops and to dip into your eye, to treat your eye problem. So all different medications are given through different routes. So make sure that you check the routes before you take the medications, right? And some medication needs to be given through the injection, okay? So all different routes. Now, also you need to check the dose of the medications, right? So dose means the amount of medication that you should take. So if you want to know how much medication you should take, make sure you check the dose and written on the package, all right? So if it is like 5 milligram or 10 milligram or 20 milligram, you make sure that you take the correct dose of medication. Don't overdose yourself. If you take too much or take too less, it won't take good effect. And if you take too much, the medication, it can be dangerous as well, right? So check the dose, okay? So dose means the amount of medication that you should take at one time, right? And also you need to check how frequently you should take the medications. Is it once a day or twice a day or 3 times a day? So make sure you check the package and clearly understand how often you should take this medication over 24 hours, all right? And also finally, you need to check the expiry date of the medications. Expiry date means like when the medication will become out of date, right? So the medication can only take effect within the expiry date, so before the expiry date. So if the medication is past the expiry date, then you have to throw it away. You cannot take it because it can cause more problems for your health if you take it. So make sure that you check the medication's expiry date, and so you don't take any expired medications. All right. So that's all the terminologies I wanted to understand in this lesson. Thank you very much for listening.